Hi guys, welcome back to my channel. I hope you guys are doing well. Today's video is going to be about the things doctors do that annoy nurses. Prescribing a non-formulary drug and not telling them. This causes loads of issues because the drug will not be readily available on the ward and it needs to be ordered from pharmacy. It does get annoying for nurses to find out during the drug round that a new drug has been prescribed. So do let the nurses know if you are ordering a special or non-formulary drug so that it can be ordered in advance. This also ensures that there are no delays and the patient gets the medication on time. Interrupting nurses during the drug rounds. Drug rounds happen 4 to 5 times a day, and it is very important that nurses are able to concentrate and give their full attention during the round. Disturbing nurses during the drug round can potentially cause drug errors, and nobody wants that to happen. Meal times. Most trusts take meal times very seriously. Meal times are protected, and unless it is an emergency, patients should not be disturbed and should be allowed to enjoy their meal. Nurses will not be happy if you try and see a patient during their protected meal time. Inadequately prescribed medications. Prescriptions are invalid if they are not filled out correctly. We have electronic prescribing in my trust, so we don't see much of this, but it gets annoying if a drug is not prescribed correctly. For example, if the frequency is not specified, if there is no signature or no units for the dose. These are really small errors, but it does make the prescription invalid, and nurses can't give the drug until the error is rectified. Prescribing IV medications to patients without a cannula. Not all nurses cannulate, so always make sure that your patient has a working cannula if you are prescribing an IV drug. Also, let the nurses know in advance so that they have time to prepare the IV medication before the drug round. All IV medications needs to be checked by 2 nurses, so it does take time to prepare IV medications. Bullying. Unfortunately, bullying does happen. In the NHS, the most common form of bullying is from a senior staff member towards a more junior staff member. So a senior doctor to a junior doctor, a senior sister to a staff nurse. Working in a high-intensity ward can be stressful. We are all under pressure, but bullying is never a good idea. We all need to help each other out and work as a team. Illegible handwriting. Illegible handwriting is annoying to everyone. Personally, I feel that your reviews and plans are more likely to be carried out if you write legibly. If others can't read your handwriting, you will definitely be paged to clarify your documentations. So save us all the trouble and please write legibly. Not reading notes. It annoys nurses when doctors ask them about things that are clearly documented in the care plans, such as what is the patient's urine output, what is their fluid balance, what have they eaten today. All of this is documented in the care plans, which is readily available at the patient's bedside. No one will be able to accurately remember all these information, so the nurses will need to check the care plans too to answer your question. Not telling nurses about stat doses. Stat doses often get missed because nurses don't know that they have been prescribed. It is not the best for nurses to come across a stat dose of medication during their drug round. So do let the nurses know if you are prescribing a stat dose. It will definitely help prevent delays. Unfriendly doctors. I know that junior doctors come and go. We rarely stay on the ward for more than 4 months. But it is important to be friendly and get to know the nurses and other staff members on the ward. It will make you feel more welcomed and part of the team. Communication. Communication between doctors and nurses is so important. So keep the nurses up to date about the patient's progress or if there are any new issues. Nurses are the ones looking after the patient most of the time. They speak to family, they liaise with other healthcare professionals regarding the patient's care. So it is important to update them about the patient's progress. discharging patients at 6 p.m. Nurses do so much more than just looking after patients. They ensure that patients are discharged home safely. So let them know as early as possible if a patient might be discharged that day. This will give them enough time to inform the family or the nursing home, arrange transport, restart the package of care if needed. All of these tasks takes time, and it is impossible to organize all of this so late in the afternoon. That is all for my video today. I hope you guys found this useful. Thank you so much for watching. If you like this video, please give it a thumbs up. Please subscribe to my channel for more videos, and I'll see you in my next video. Bye!